further ado, I would like to now bring on our guest speaker, Mr. Dumbor. If I'm pronouncing your name right, sir, can you please go ahead and maybe if you can remind us again, your introduction, and just take it from there.
Right, thank you very much. I'd like to share my screen because I've prepared a presentation. I'll try and be brief, but I just wanted to try and cover as much as I can and try not to be too pedantic, so I'm not discussing the medical terminologies. I am a consultant heart surgeon at Castle Hill, and I am also the chair of the BAME Leadership Network. I will just briefly go through this presentation in this format, just give us an overview of the pandemic, and we will talk about it through. I know that we're pressed for time, so I will try and keep within the time. Now, globally, we all know that this pandemic started in China, in Wuhan city, and it spread from there across to Europe. Now, the first case of coronavirus or COVID-19 in the UK was actually diagnosed in our region in Yorkshire. And the first case was treated in Castle Hill Hospital. And the first patient with COVID who was operated on in Castle Hill Hospital was operated on by myself. So it's a message that is very close to home for me because I have been involved in this pandemic. Now, it soon became apparent that there was a disproportionate impact on the BAME community. And after the first case that I was involved in, I had no doubt that there was, before the publications, and I did speak to members of my department and also raised some concern. And at that time, we did not have enough PPE and there was not testing. So there was a bit of concern. And unfortunately, as you can see, 60% of the deaths among healthcare workers were in the BAME community. Why is that the case? People have looked at different factors, and you can see here what people have been touching on. But clearly, the thing that stands out here is in terms of employment, we're employed in areas where we are exposed. There is deprivation, racism and discrimination, and there are most of these other factors which are not basically medical issues. And it soon became obvious that there was a lot of socioeconomic risk factors that was contributing to this trend. Now, there was a publication in the BMJ, which is the medical journal, that clearly says that the BAME medical staff were less protected from BAME than their white colleagues. And this was based on a survey. So this, what we were saying was not just the result of the fact that people had decreased immunity, but the fact that there was evidence of socioeconomic and discrimination contributing as well. What is the signs of COVID? COVID-19 is caused by a virus. It spreads through breathing, just breathing, coughing, sneezing, and contact, which is either direct or indirect contact. There's up to 60% of people who actually spread it do not have symptoms, either because they are in the phase before they start to develop symptoms or they don't have symptoms at all. So it makes it a very worrying disease. It affects the lungs and makes it difficult to breathe. And that is why people often end up on ventilators. And there is no current treatment. There's no treatment for COVID. You can only support the patient's immunity to be able to deal with it themselves. There are errors on social media. It comes through different forms. And I think it is something that we need to be aware of because some of this relates to the BAME community. People used to say that hot weather did not, kill the virus, so they exposed themselves to temperatures over 40 degrees and get burnt. There was also the false belief that washing religious rituals like washing several times a day prevented it. But that again, because the hand washing is not directed at COVID and not done after contact, does not contribute. Hot or spicy food has no role again. And you could go on and on. Chloroquine has been shown not to have any effect. And it is not because of 5G network that COVID is spreading. So there are a lot of this myth. Importantly, and I think because of experience, people from the BAME community are very suspicious of studies, and they feel that people from BAME network are not treated the same way as white people when they're enrolled in studies. So people are very suspicious because of the history of what happened in America when, Black people were allowed to, or infected with syphilis, and then they just let them progress without treatment to see how it's, the cause of that disease. But things have not changed. There's a lot of regulation. So some of these are myths that we need to address. Now, what about the politics of COVID-19? Interestingly, one of the publications in a reputable journal talked about the upper lip approach of the British government. There was the talk about the herd immunity, and then we've got the testing. Now we're talking about test and trace. There have been different things that have, impacted upon the COVID-19. The experts give their opinion, but the politicians are the ones who decide how to implement this. So not only in the UK, but across the globe, politics has a role in this COVID-19, and it is contributing to the way that this is being managed. And then, unfortunately, the tragedies of COVID-19. There are some of the tragedies that we can actually quantify, but there are a lot of it that are not quantifiable. We talked about deaths, and we all followed the deaths when it was being announced. Now, what about people who could not get into hospital, who died because they couldn't get into hospital? Some of those are not recorded. We know about the economic impact, and then the unmeasurable impact is the way it's disrupted social engagement and the way people interact. Parents cannot hug and greet their children. People cannot meet in as they used to meet before. The educational system, we saw what happened with the educational system over the summer. Mental health issues have gone up. There was report of increase in domestic violence during this lockdown. So there are loads of this unfortunate occurrences that occurred with the COVID-19. Now, this is a graph that shows the death rate following COVID, and we are all familiar with this. We've lost over 41,000, citizens of the UK over this period, and what is worrying is that the trend is beginning to creep up again, and I will show you the slide for that. How have we responded to this? Now, in our hospital, we were involved in developing a risk assessment and also the adjustments that needed to be made to protect the BAME members of staff. We also had a committee that adjudicated, or if there was any dispute with any of the BAME members of staff. We are tackling inequality in the workplace. We've made recommendations to our management, which we are looking at the moment, and raising awareness and education. We've written blogs about loneliness. We've done different things to try and keep that going. And of course, importantly, supporting ourselves and our communities like we are here today. And our intention is to try and engage with other members of the BAME community in the local area to be able to bring them the information that they need to deal with this pandemic. Now, I've heard people talk about the opportunities that COVID-19 has provided, and I think that we can turn this tragedy into possibilities. And also the counselor, you know, when she was talking about her, the fact that she can now discuss, you know, her concerns openly. One of the things that COVID-19 has done is that it has put discrimination, it has put inequality in the public domain. Now, in the medical area, this New England Journal of Medicine which is a very, very respected journal, has run a lot of articles about discrimination, inequality. And, you know, also in the media, you talk about the television is there, in the newspapers. These issues have all come up. So this has brought the problems that has always existed to light, and people are free to discuss this now, unlike before when people could not discuss these issues. What should we be doing, and what must we do? Now, we have to do something because, as I said, the numbers is beginning to increase again. This is happening regionally. In the whole area, the numbers have tripled in the past 1 week. Nationally, we know about the lockdown that is occurring in different parts of the country, and globally, there are many places you cannot travel to because the rate is beginning to increase again. And also, we are now getting into the period of the seasonal flu, so that is another problem. This is the recent plot graph that is showing in the UK, the second wave of coronavirus is coming. And you can see that it's beginning to creep up again. And we've been, you know, listening to the news. Government is contemplating, is there going to be a second lockdown or not? So there is the need for us to do something. And what is it that we have to do? Simple. Let us follow the expert advice: social distancing, avoiding crowded places, the rule of 6, washing your hand or using alcohol gel, wearing a face covering or face mask, and avoid traveling to, you know, areas that are, you know, have high risk or high incidence of coronavirus. We have to look after ourselves. And I think this is an area where the BAME members of BAME community is at fault, because we have a sense of duty and we always want to go to work. Even when you have the symptoms, you think, oh yes, just a minor cold, you go off to work. No, if you have symptoms, you have to self-isolate, not just from your colleagues, but from your other family members, so you don't spread it. So we have to look after ourselves. We have to contribute to the discourse now that, you know, the issues of inequality is in the public domain. Wherever you have the opportunity, contribute to it. If you're a musician, raise it in your music. If you are, you know, a counselor, this is the opportunity. We have to raise the awareness in our communities about coronavirus as well, and support these communities. Now, about studies and clinical trials, I think that the problem we have had is that most of the trials that we've had have only recruited mainly white people. So the results that these trials produce are often not applicable to the BAME community. So we have to participate to be able to, for that result to be relevant to us. And I'm not saying that you should enroll blindly into trials. No, I think you should ask the right questions and make sure that you are happy with that trial. Now, one of the things which I have tried to do in our network, we've got requests to announce, you know, all these trials in our network, but I've refused to use our network as a platform to recruit patients for trials. But I encourage people to look at the trials, see if you agree with it, if you're comfortable with it, and then you enroll in those trials, because it will help our communities. Thank you very much, and I'll wait for the questions. Thank you.
Thank you very much for that, sir. Very informative indeed.